today.
Halloween, everyone. It's not actually Halloween, but this is the closest PS show to Halloween.
Because next Friday it'll officially be November. So,
do y'all
do you like this?
Mm-hmm.
Can you guess what we are? Can you take a guess?
So she obviously is Ashley and I'm Jessica.
Exactly. We switched places.
No, we were thinking about doing that. That would have been funny.
This makes my nose look kind of crazy. Okay, so what are we going to talk about today?
So, today, we are going to talk about our spookiest,
So spooky,
bloodiest facial.
It's actually more than a facial, to be very honest.
Oh, no.
It's
magic.
It's more than magic, I feel like.
No, it's amazing.
Mm-hmm.
So, let's talk about it. We are talking about SkinPen today.
Yes, it's so spooky and bloody. You're going to love it. You're going to want it.
You're crazy.
Sorry. Oh, yeah, because I'm going to read comments.
Okay, cool.
So, SkinPen is what we're going to talk about.
So, first off, med spa procedure.
Mm-hmm.
You can't do it just at, your neighborhood spa. It has to be done in a doctor's office because
or should be done.
You are, messing with your skin. Look at these little, look. Okay, so you are going, so essentially, we're aerating your skin.
Yes.
I like the way, Dr. Sukar is cheering on, that's not LSU. I don't know what the LSU sign is. He's cheering on LSU today, so I got some help from Dr. Steinberg today on what it is, why it is, the sciencey words behind it.
She does like the sciencey stuff behind things. So.
Yeah. So, what it is basically minor trauma or micro trauma to the skin. Mm-hmm. But just like we talked about last week with the phenol peel, it's good trauma. It's good controlled not drama, but it is kind of dramatic because
trauma. Yes.
What happens, Jess? Take us through it.
Okay, with SkinPen, it's a microneedling treatment. So the trauma that's happening to your tissue, there's an end result that we're working towards when we cause this trauma. So with the microneedles, they're very, very teeny tiny little needles. And
even smaller than the Botox needles.
Yeah, they're super duper tiny. And in the apparatus, there's a handful of them. I want to say there's 14 or more of them in the little tip that we use.
And it's tiny. So
super tiny.
Yeah.
So what we're doing is we're causing little micro channels into the tissue, and we're telling your tissue to stimulate collagen and to remodel. So we're remodeling your collagen
and
in your tissue. Yes.
So what Dr. Sukar has said in layman's terms, to put it in Ashley terms, if you, not that I go out on the farm all the time, but if you were out farming, you aerate the lawn, and you're creating little, or cleats, right?
Oh,
It creates little holes in your garden, your farm, whatever. And why does it do that? So that it can
absorb all the good stuff, whether it's fertilizer or your water or your products that you're using on your skin. Or if we're doing an add-on to the SkinPen. So the main goal with doing SkinPen is to remodel your collagen and your tissue, so that way we've got improved texture, improved tone. A lot of times patients,
fine lines.
And especially even with with having large pores in the center of our face, around our nose, that really helps because we're remodeling things. So it's remodeling those pores, so we're getting those pores to shrink down. Now there's some things we add on to it to do an even better job of that, but
also, so what I've seen and what it's really great for is acne scars, right?
Yes.
So I've been blessed. Back in middle school, I had a face full of acne, but some people have it up until their late teens, 20s, 30s,
early adult.
And so if you had it and you pick it, which we all tend to do.
Yep.
You're going to leave scars, and those scars turn into these textural issues.
Right.
This is a great way to get rid of it.
It really is. And last week when we talked about phenol, we talked about that patients who have acne scarring, even though the phenol peel is very aggressive and it resurfaces, it's really not the best way for that, because when you've got acne scarring, you've caused some kind of damage to your tissue, and it's reacted that way to cause that scarring.
So it's just aerating, but then putting the bad stuff back in,
Yeah, so with the microneedles going in there and basically remodeling things, we're remodeling how your tissue is healing in that scarring that's there. It's really very fibrous, so we have to go in and break it up.
Can you believe this is a med spa procedure? It's not surgical.
which is awesome.
So let's talk about, should we talk about candidates first or the process first?
Well, I think maybe let's start with candidates because it's
really open.
Yeah, I mean, the patients are candidates for this procedure for any aspect. If there's no issues with their skin, they just want to maintain things, from all the way to acne scarring. Now, I will tell you things that it won't address and take away really is going to be hyperpigmentation. So if you've got hyperpigmentation, we need some sort of aggressive treatment like a laser or a chemical peel to pull and lift that pigment up and out. But from a level of tone, texture, brightening, things like that, SkinPen is amazing for this.
Okay.
So.
How about treatments? I know, sometimes it is a one and done, as in it will improve it'll make your face glow.
Right.
Jessica, I think she's perfect in every way because this is my little wifey, but she does get it done every so often just to slough everything off, aerate it, and just create new collagen.
Yeah, because, well, actually something that we learned yesterday, I didn't know that. I've been an esthetician for 13 years.
What?
The age that we stop producing elastin.
Oh, yeah. That's kind of scary.
My mind was blown. Do you even want to take a guess at what age does your body stop producing elastin?
How do your body just say, no, we're not doing that anymore.
Stop.
We're not going to do that anymore.
Do you want to know? Do you really want to know what age? You're going to have to pick your jaw up off the floor, because that's what happened to me yesterday. I was like, you're lying.
What is it?
You're lying. 3 months. Not 3 years, not 30 years. 3 months old, your body stops producing elastin.
So I'm done.
Well, I've been
done,
for a long time. Yeah.
Well, I still have 9 lives, so maybe I'll get some more in my next one.
Maybe in your first 3 months of your next life.
Yeah.
So, what were we talking about? Because I just fully jumped to
elastin.
Oh, yeah.
But before that,
yeah. I got
ages,
sidetracked.
I guess. Candidates. How many times?
Oh, yes, that's right.
Okay,
I got all excited about sharing.
Sometimes it is one and done. You can get it done once in a while. What do you do? Once every...
I try to do it about once every quarter. We are so swamped here with patients, so getting treatments in for ourselves is a lot more difficult. But ideally, because I don't have a lot of major issues with my skin, I try to do it at least once a quarter just to maintain, keep things moving, because we're constantly aging, and I'm not going down without a fight.
Yeah.
So, but if you're trying to get an end result, let's say you're coming in with a particular issue, that you've got acne scarring. Let's kind of go there, because I think this is so important to touch on, because there's so many people that have acne scarring that don't know that there's solutions.
And then you let it progress, and then it turns into this thing called ice picks, which I didn't know. When Dr. Steinberg told me about it, I was like, is that a thing that they did in the 80s, picking your face with, I don't know, crazy stuff happens, we're putting needles in your face, so no. It's a term that people use for when your acne scars get so severe that it looks as if you just picked them with an ice pick, really low, deep or whatever.
Very deep. So with acne scarring, when we're trying to get an end result, we need to do a series of these treatments, and they're usually spaced about 4 weeks apart. Sometimes they're 3 weeks, sometimes they're 6 weeks. It all depends on your skin and its needs, so we'll discuss that when you come in. But we typically do a series, and we start with a series of 4 treatments spaced about 4 weeks apart.
Okay.
And when it comes to acne scarring, they didn't happen overnight, unfortunately, and we can't treat it with one time and be done overnight, okay? So we're going to do a series. We're going to start with 1 series, because this is going to be a little bit of a process when it comes to acne scarring. Some patients, we're good at 4 treatments, spaced 4 weeks apart, and your skin is great. Other patients that are more severe, sometimes we have to do a series of 2 or 3 of these packages of 4, because things are so severe.
But there's definitely patients also that they do look great, but they're like, I want to look even better. Exactly. So you don't need another series, but I'm going to keep doing it. I'm going to keep doing the maintenance thing.
Right.
I'm going to keep going.
And for patients like that, a lot of times we'll still do a series of that 4, and we even space them 4 weeks apart and just hit their skin really hard on those first 4 months. And then after that, it's something they do on a maintenance program, whether it's every quarter or every 6 months, then we're just doing those things to maintain. So if we're trying to hit a certain end result and we need to be aggressive, we are going to be doing a series of these treatments spaced about 4 weeks apart. I like to say 3 to 6 weeks, because everyone's skin is really different, but average is about 4 weeks apart.
Okay.
So
and Jana will tell you, let's put it off another week, or no, you can definitely do it in 3 weeks.
Yeah. Now, a lot of patients want to know downtime. Downtime is big, right? Because we want to know, and it's not downtime, you can't go to work, you can't go out and do things. It's more of a social downtime.
It's really no downtime. This is a no downtime procedure. That's what they say. That's what they...
Like, you don't have to lock yourself up at home and take off from work.
Like phenol peel.
Right. But there is a social and the reason I like to call it social downtime is because there is going to be some pinkness and some redness, and there's going to be some flaking and peeling, just because we are trying to create a result, right?
And not everyone's like Jess and I, who will go out bare face. We own it.
We're like, do you see this?
Yes,
I
just did do something. Thank you very much.
Yes.
But if that's not you, if you want to hide it from hubby, or you want to hide it from whoever, whatever, just take the day.
Yeah. And
how many days are we not going to wear makeup?
So Jana likes us to not wear makeup for at least the first 48 hours. So remember, we've created all these micro channels into the tissue, all these little holes we've aerated. They're teeny tiny. When I say holes, there's not like massive holes. Mm-hmm. And so like we don't want you to then just put makeup back on and pack it, and then that's going to go down all these channels, and you could potentially have some breakouts. So we want your skin to breathe for at least a good 48 hours.
Well, and think about it. That's scary. Like, you just made these holes.
You're like, I'm trying to get things looking good.
And then you want to put that nasty stuff in there.
Yeah.
Act like I use. Ugh.
Don't even get me started.
I know.
Don't even. Okay, so for me, just when I do SkinPen, we do it very aggressive because that's what I like. I'm like, go big or go home, sister.
Mm-hmm.
And we do some extra things on top of it, some add-ons we'll talk about in a second, I think would be good to mention.
Yeah.
So the first 48 hours, your skin feels very, very tight. So the first 48 hours, I wear bright lipstick, I go bold, and my eye makeup. So I'll do mascara and lips, and then I call it a day and let everything else just be as is. First 2 days,
you'll be a little pink, right?
Yeah, a little pink, kind of like a mild sunburn, really.
Right after, you're going to be a little red, but, you know, like I said, just take that day, don't go back to work, unless you want to. I mean, I would.
Yeah, that's up to you.
Because I work
really.
here, but, you know.
Exactly.
But then 48 hours, we're going to try not to put any makeup on.
Yeah, so that first 48 hours, and then after that, you're probably going to start to notice some peeling and flaking, which is normal, and we want that because we're trying to get things to fluff and go. Mm-hmm. When that's happening, if you are wearing makeup, just know that it's going to look a little funky because you're having some flaking and peeling. So
you might go up to and be like,
what? We got a
let
little,
me just get that right there.
Little
but you don't want to like peel. I mean,
right?
Know.
Yeah. So
like nail cover. I know I'm getting kind of gross, but it's not going to be that bad. It's
really not. And then for the next handful of days, you're just going to see some flaking and peeling, things like that. And then what I love is about a week after my SkinPen, I'm like, ooh, my skin, love it. Mm-hmm. So
hair toss, check your nails,
baby, how you feeling?
I'm good.
And I'm like, so we talked about what it's good for, what we're targeting, downtime.
Let's talk about like going through the what are we actually doing, and then what we add on.
Like when they get here?
Yeah.
Okay. So when you get here, we are going to numb you. So don't think we're going to be like jabbing you with needles.
But guess what? There's someone that I'm sitting here with that doesn't even do numbing.
Let me backtrack on that. Because there were 2 times that I could not do numbing with the SkinPen, and it's because I was brewing a baby and was not allowed to use topical lidocaine numbing cream. So I had to go
Jess, you can get this done when you're pregnant.
Yeah. We're not. I mean, with that, we're not putting anything.
Right. You're not.
We're just creating micro channels.
Mm-hmm. And you can't get numb. And
yeah.
I would be a scaredy cat. I would be a scaredy cat.
Okay, that was like
good, right? That was a Jess joke.
Yeah, that was definitely a dad joke. Okay, so we'll get you numbed, let the numbing settle in, and then we begin the treatment. There are different settings for different parts of the face and different needs. So again, some patients may need to be more aggressive in certain parts of their face, and other areas like, the forehead we typically don't have to be as aggressive with, because most acne scarring is usually on the lower portion of the face, and that's usually where our texture issues, pore size, all that jazz. Okay? So a treatment itself, usually you're here for about an hour. We get you here, get you numbed and ready, skin all cleaned and prepped, and then to perform the treatment. The SkinPen treatment actually only takes about anywhere from 15 to 20 minutes, maybe 25 minutes to be on the patient. But the numbing process, we want to make sure we give you plenty of time to get numbed and comfortable and skin prepped and ready to go.
You want to make sure.
Now, we do a lot extra time when doing this because a lot of times patients want to do an add-on. And there's 2 add-ons that we do with SkinPen that are so amazing, and I always do one or the other. Never fails.
She does. Because this girl, like she said, go big or go home. If you really want to see
if you're going to be doing something to my face, let's just bang.
Yeah,
hit it.
definitely.
Okay? So, So one of the add-ons is PRP.
And we talked about that a couple of weeks ago.
Yeah.
Where we just didn't, really go in depth on the microneedling part. But PRP, can I just sidebar real quick?
Mm-hmm.
Because do you know that SkinPen is the only FDA approved?
Yes. Oh, we didn't even
because
say
that. There are lots of different things out there that you can do for microneedling. But
SkinPen is the only FDA approved
ones.
Mm-hmm.
No.
Just no.
We want the real thing.
Yes.
Thank you. Real Louis, not fake Louis. So, just a little sidebar on we're using the safest, best stuff that you can.
Exactly. So first add-on is PRP. It's the most common one that people usually hear about or know about. So platelet-rich plasma.
Remember, that's your own blood.
All the good stem cells.
Stuff.
All the...
Oh, don't talk about stem cells. I'm reading this one. I'm listening to this one podcast.
Oh, great.
Anyway, I can talk to you on the podcast.
Okay, so we get all the good,
the
fertilizer
from your cell.
From your blood. So we draw your blood, we spin it down, and we extract all the platelet-rich plasma.
Mm-hmm.
And what we do is when we're doing the SkinPen, as we're driving and creating these little micro channels, we're driving that PRP into your tissue. So fertilizer, what does it do to your crops, your plants, your trees? What does it do? It helps it flourish and grow faster and healthier. Mm-hmm. So that's what it does to your tissue. Yeah. Exactly. So it's helping your tissue heal and regenerate and all these wonderful things at a much faster pace. It's kind of like the icing on the cake with the cherry and sprinkles and all the good stuff.
We'll talk about the other cherry on top is Sculpture, right?
Yes. So Sculpture is actually an injectable filler that we utilize, and I talked about when I was talking about booties the other day, a couple weeks ago.
Yes.
So Sculpture helps your body to create collagen and stimulate it and grow, right? So when we're doing it on a micro level into the tissue, we're helping that collagen stimulate. And so through here, it literally is like a magic eraser with your pores. Like the first time I did it, I was like, I've been missing out on this my whole life. Like, what the heck?
Jessica's usually not speechless. But
I even was texting Jana later, and I'm like, not see these pores. Like, what is going on? How did it erase them? Literally hours after. So
I didn't know about the pore thing.
I was so speechless.
I haven't done SkinPen yet, but
for
that,
we're getting there. We're gonna get it.
Yeah.
So
I might let you record it, but remember when we tried to record my laser hair? That was not.
Yeah. So anyway,
loud.
SkinPen and Sculpture are amazing add-ons for SkinPen, depending on what your skin's needs are. So we will definitely educate you on letting you know if you're a good candidate to add them both, or either one of them on, because I'm pretty sure you are, and which one may be better for you. And a lot of times I'll alternate, go back and forth. So one time I do SkinPen, do with PRP. Next time SkinPen and Sculpture.
Hey, Jess, guess what?
What?
One of those things is on sale right now.
I totally forgot. It's literally only for, today, but only for 4 more days because it ends on next Thursday on Halloween. So you want to tell them what the special is? It's really spooky good.
No, you tell them because I forgot what the number was. Okay,
so SkinPen with a PRP add-on is normally $800. But until next Thursday, the 31st, it is $675. Y'all, another moment to be speechless. So, if you're ready to get your SkinPen with PRP, make sure you do give us a call and get on the schedule for next week. Monday, Tuesday, Wednesday, Thursday are the only days, and I'm pretty sure Monday is already completely booked, and we only have a few spots left on Tuesday, Wednesday, Thursday. So, if you want an appointment and you're ready to snap this bad boy into shape, you need to call us ASAP. We're here till 3. So call today, or you can email me if you have my email, and that way I can get you an appointment on the schedule.
Or you can message our page if you have any questions.
Either way, just reach out ASAP so we can get you on the spot.
Yes, we definitely want to be able we want you to be able to take advantage of that sale.
Yes, absolutely.
And so what else?
Oh, okay. One reminder before we go, because we are about to go. We were trying to keep these short and sweet, even though we could talk forever.
I know, right?
Do not forget, we have an online
store.
Yeah,
our online store, and it makes everything so easy.
Y'all.
And a little spoiler alert, I'm about to release a coupon code for first-time users.
I can't wait. I'm going to be sharing it on my personal page, but it's very exclusive to you watching.
Yeah.
Okay?
Ooh.
And our Facebook followers. So make sure you are interacting. Try to get that top fan badge, sister. I mean, come on.
Yeah.
So make sure you're interacting. But we do have our online store. If you go to our website, drsukar.com, you'll see a shop online button right down here.
Right.
Click that. Do a little tappy poo. You can buy any
just one.
Oh, okay. Oh, yeah, just one. one tap. And you can purchase any of your favorite skincare products. Also,
even
you
cats can do it. It's so easy.
Yeah, you can even pre-purchase your Botox, your Dysport, your fillers.
And we have
your
memberships.
Yes.
Maybe one of these episodes we need to do.
Katrina said we look though.
No, it's Karina.
Oh, I'm sorry. I'm trying to add a T in your name. I'm sorry.
Oh, hey, Sydney girl.
Hey, Sydney.
So
Okay, don't forget to shop online.
shop online.
Add your favorite treatments.
Comment, like, share.
Yes.
Ask us any more questions you might have.
And I think you should just give us a little shout out for how cute we look.
Let us know
I
what you
think we should do like face costumes at every episode. What do you think?
Yeah, but it might take a while. Because Jess did both of our faces, just so you all know. She is like extraordinary at makeup. That was like what she moonlights as or whatever.
In midnight hours.
Yeah.
Okay, so I think we've covered everything. If you have any questions, anything we missed that you want to know, make sure you drop a comment below. Click the little share button, the little heart button. You can tap it a few times if you'd like. And
that takes it off.
Oh,
if you tap it.
But when you're on live, if you tap it a couple times, it'll send like multiple hearts. It'll go.
Okay, just make sure it like really does.
Yes,
stay.
absolutely. Okay, so remember.
Oh, I didn't know we were going to do it
right
in there. Okay, yes, it is.
Let me try again. Hold on one second.
Okay.
So remember, beauty's in the details. And thanks for watching the PS show with
Ash
and Jess.
Or the kitty.
And the deer.
Oh, dear.
I can't decide if I'm Bambi or not, but we're going to roll with the deer. Okay.
You're cuter than Bambi.
I don't want to knock my horns off.
I know. I already like hit you with mine. Okay, guys.
Okay,
we'll see you next week.
Have a wonderful weekend. Thanks for watching. Heart, like, comment, share, do all the things to spread the love, sister. And y'all have a great weekend. Go Stros!
Go Stros!
We're gonna win. We're gonna win. We're gonna win. Go Stros. We're going. Okay. All right. Bye, guys. See y'all next time.